After 60, the biggest mistake you can make with food is believing one superfood will protect you from cancer, or that your diet no longer matters because the damage is done. Neither idea is true. No food can guarantee you will avoid cancer. No vegetable, drink, spice, or supplement can treat a tumor. But how you eat can support healthier weight, better digestion, steadier blood sugar, lower inflammation, and a stronger foundation as you age. Cancer risk is influenced by many things: age, genetics, tobacco, alcohol, body weight, physical activity, infections, environmental exposures, and long-term eating habits. Eating well in your 60s and 70s isn't always simple. Appetite may change, chewing can become harder, medications can affect taste or digestion, shopping and cooking can feel tiring. So every food on this list must pass a practical test: affordable, easy to prepare, and flexible enough to fit into meals you already know. A habit that looks impressive but can't be repeated isn't useful. Here are 10 ordinary foods that fit into a balanced diet for adults over 60. They are not miracle cures or replacements for medical care. They provide fiber, vitamins, minerals, healthy fats, and plant compounds your body uses every day. Before we begin, if you have kidney disease, diabetes, digestive problems, food allergies, take blood thinners, or follow a prescribed diet, speak with your doctor or dietitian before major changes. Script 8, number 10. Garlic, onions, leeks, and other alliums. They're not magic shields, but they add flavor without lots of salt, sugar, or heavy sauces. They contain natural sulfur compounds under study for supporting normal cell processes. When food tastes better, healthy meals are easier to continue. Use real garlic and onions. Crush or chop, let garlic rest briefly, then cook it. If raw garlic irritates you, cook it gently or use less. Script 9, number 9, green tea. It contains catechins, plant compounds often called antioxidants. Evidence on green tea and cancer prevention is mixed. Still, replacing a sugary drink with unsweetened green tea is a reasonable habit. If caffeine affects your sleep, choose decaf or drink earlier. If you take medication, especially blood thinners, check with a healthcare professional. Script 10, number 8, mushrooms. Affordable and easy to cook, mushrooms add flavor and texture without much saturated fat. They contain fiber, B vitamins, minerals, and compounds studied for immune relationships. They don't boost immunity on their own, but they fit into a varied diet. Use common varieties like white or brown mushrooms. Add them to eggs, soups, stews, rice, or pasta. Cook them well if digestion is sensitive. Don't assume expensive powders are better than ordinary mushrooms. Number 7. Tomatoes, especially cooked tomatoes. Tomatoes provide vitamin C, potassium, and lycopene. Lycopene is studied for prostate health and other outcomes, but tomato sauce does not prevent cancer. Cooked tomatoes make lycopene easier to absorb, especially with a little healthy fat like olive oil. Tomato sauce, soup, and crushed tomatoes are useful. Choose lower sugar and appropriate sodium. If you have reflux, adjust portions. Number 6. Nuts, especially walnuts. Nuts have healthy fats, plant protein, fiber, vitamins, and minerals. Walnuts provide plant-based omega-3. They're a good replacement for processed snacks. Portion size matters. Use a small closed handful. Add chopped nuts to oatmeal, plain yogurt, or salads. Choose unsalted or lightly salted. If chewing is hard, try ground nuts or smooth nut butter without added sugar. If swallowing is a problem, check with a clinician. Number 5. Berries. Blueberries, blackberries, strawberries, and raspberries provide fiber, vitamin C, and colorful plant pigments studied for antioxidant and anti-inflammatory roles. They don't detox the body, but they give sweetness with fiber, making them better than many desserts and sweet breakfast foods. Frozen berries are a practical, less expensive option. Avoid added syrup. Add to oatmeal, yogurt, or smoothies. If you have diabetes, watch portion size and the rest of the meal. Number 4. Oily fish. Salmon, sardines, mackerel, and similar fish provide protein and long-chain omega-3 fats that support heart and brain function and help regulate inflammation. That matters because after 60 you need to consider muscle strength, heart health, mobility, memory, and bone health. Sardines are affordable and provide calcium when you eat the soft bones. Bake, grill, or steam fish or add it to salads and whole grains. Avoid deep frying or heavy sauces. If you take blood thinners, have gout, or must limit certain minerals, check with your healthcare professional. Script 15, number 3, cruciferous vegetables. Broccoli, cauliflower, cabbage, kale, and Brussels sprouts provide fiber, vitamins, minerals, and plant compounds widely studied in nutrition science. Claims that broccoli switches off cancer are exaggerations. Regularly eating vegetables is associated with better overall health, especially when they replace processed foods and support a healthy weight. Light steaming, roasting, or quick sautéing preserves texture. Increase portions gradually if your digestion is sensitive. If you use warfarin, aim for consistency deficiency with vitamin K and speak with your medical team. Script 16. Number 2. Coffee. Plain coffee contains polyphenols. Observational studies show associations between coffee drinking and lower risk of some diseases, including certain cancers. But association isn't proof. Coffee isn't required for good health. If you enjoy it and it doesn't worsen anxiety, reflux, sleep, arrhythmia, or blood pressure, moderate intake can fit a healthy routine. Decaf still has many plant compounds. Watch what you add. Sugar, flavored syrups, and oversized portions cause more harm than the coffee itself. Follow your doctor's advice about caffeine. Number 1. Beans, lentils, chickpeas, and other fiber-rich legumes. Not glamorous, but practical. Beans and lentils provide fiber, plant protein, iron, potassium, magnesium, and other nutrients. Fiber supports bowel regularity, feeds beneficial gut bacteria, and links consistently with better digestive health and lower colorectal disease risk. That doesn't guarantee protection, but fiber-rich foods are an important long-term pattern. Many older adults don't eat enough fiber. Start slowly. Add lentils to soup, mix chickpeas into salad, replace part of meat in a stew with beans, use oats or brown rice instead of refined grains sometimes. Canned beans are fine. Rinse to reduce sodium. Dried beans cost less but take more prep. If beans cause gas, begin with small amounts. Rinse them, drink fluid unless restricted, and increase fiber gradually. Some bowel conditions need different approaches. Seek medical advice. Now turn this list into a realistic plan. You don't need all 10 foods tomorrow or a perfect diet. Choose 3 changes. Add 1 fiber-rich food to a meal you already eat. Replace 1 processed snack with a nourishing option like berries with plain yogurt, a small portion of nuts, or vegetables with hummus, and put fish and vegetables on your shopping list before you enter the store. Also focus on habits that matter. Don't smoke, limit alcohol, stay physically active safely, maintain a healthy weight without extreme dieting, keep medical appointments, follow recommended screening schedules, and report persistent or unusual changes to a healthcare professional. Most important, food is not cancer treatment. Food cannot replace colonoscopy, mammogram, prostate discussions, skin exams, vaccinations, scans, biopsies, surgery, medication, radiation, or any medical care recommended by a clinician. Food can support the body you live in every day. More fiber, fewer processed ingredients, better fats, and more variety. Over time, those habits may contribute to lower disease risk. That's a realistic promise, not a guarantee. After 60, direction matters. You can't control age or genes, but you can choose what goes in your cart, how often you move, whether you smoke, how much alcohol you drink, and whether you attend screenings. Before your next meal, ask, what can I add that supports my health? Maybe a spoonful of beans, maybe a side of broccoli, maybe sardines instead of processed meat, maybe berries instead of a sugary dessert. Small changes are easier to repeat, and repeated changes create a real eating pattern. Which of these foods is already part of your weekly routine, and which will you add next? Share this video with someone over 60 who is tired of miracle claims and wants practical, honest guidance. Subscribe for more clear, age-focused nutrition content that respects the difference between helpful food choices and medical treatment.